Good afternoon, and thank you for joining me today as we talk about COVID-19 here in Erie County. What a beautiful weekend we had here in Erie County. And while I love seeing people in their yards and out enjoying their family time, I have to say it was actually alarming to see a lot of people gathered without wearing any masks, and store parking lots just packed. We haven't even officially gone into the yellow phase yet, and people are already congregating and electing to forget or ignore how dangerous the COVID-19 virus really is. We still do not have a good treatment for the virus or a vaccine. So I am very, very concerned. I do hope to have more guidance soon, but the guidance will only go so far. People have to follow the guidance in order for it to work here in Erie County, across our Commonwealth, and across our nation. Since Saturday's briefing, we have had 3 new positive cases of COVID-19 here in Erie County. 2 of the new cases are in their 40s, and 1 is in their 50s. They all reside in Zone 1, which can be found on the cumulative cases map by zone at eriecountypa.gov. So our total number now is 93 cumulative positives, 2,133 negatives, and 67 have recovered from COVID-19, with contact tracing continuing at the Erie County Department of Health. Crawford County has 19 positive cases, McKean has 6, and Warren County has 1. Chautauqua County has 37 cases and 4 deaths, and Ashtabula has 146 cases and 15 deaths. The state now has 50,092 cases and 2,458 deaths. So please, all of you, continue to stay home as much as you can. Wash your hands frequently. Wear your mask when you leave your home. And when you're out around other people, keep at least a 6-foot distance from them. Our environmental team has continued to make field visits and is working within the guidelines that we have been given from the state and those that we are still awaiting from the state to assist our businesses to help them reopen come Friday when the yellow phase is upon us. So thank you all for doing your part to slow the spread of COVID-19 here in Erie County, but this is not over yet. In fact, it will be here, we believe, for quite some time. A lot of people would like to believe that the pandemic doesn't affect them, and maybe if they don't live in Zone 1 where we've seen our most of our cases, it really isn't something they need to be concerned about. Unfortunately, there will be those who will not comply or understand until either they get sick or someone they really care about gets sick. The fact of the matter is that COVID-19 has taken people from every state within the United States, at every level of society, every race, and every age group. I'd like to take a moment now to share a few real-life stories of people who have died from COVID-19. Gloria Garbatsky died on March 16th. She escaped Nazi-occupied Austria and went to New York City. She was a breast cancer survivor also. Patricia Friesen also died on March 16th at the age of 61. She was a nurse in Chicago. While her family was coming to terms with her death, Patricia's sister, Wanda, became ill and died a week later at the age of 63. Des Ann Roman was a 36-year-old principal in Brooklyn. She used her own story as an immigrant growing up in New York City to demonstrate to her students that disadvantaged people can truly succeed. Benjamin Bush Jr. was a father of 4 and a football coach for his kids' team. He was only 42. Conrad Buchanan, a 39-year-old DJ and father from Fort Myers, Florida, was gone just a week after he felt symptoms, and his family did not get to say goodbye to him. 25-year-old Basie Offing was a chemical engineering student at Western Michigan University and just weeks away from his graduation. And the list goes on and on and on. It doesn't matter that we don't know any of these people personally, because they were all loved by someone, and their loved ones are hurting. Their loved ones couldn't be there with them, in their last days. They couldn't comfort them or console one another. And then they couldn't celebrate their life with a service after this person had died. The last time that our country experienced a pandemic of this enormity was more than 100 years ago. Those who are still alive today were just babies at that time. So there's no one really alive who can share what they experienced and how they got through it. As the state allows businesses to reopen, please keep in mind that everyone must still protect themselves and others from the spread of COVID-19. Even if you don't get sick, you don't want to be the reason that someone else gets sick or worse and dies. So please, just think about these stories, because it is important for all of us to understand that COVID-19 is in our community and it will spread if we don't all be partners and try to keep it from spreading. And now I'm going to open up to the media for questions. And we're going to start with Erie News Now.
Good afternoon. You say you're hoping for more guidance from the state soon. When would that be? Any clue when you might get more guidance from Harrisburg?
Well, as I was driving up here, I was on the phone with my contact from the governor's office, and we are supposed to get it yet today, but here it is, 3 o'clock after 3, and we have not received it yet. And so we are anxiously awaiting this new guidance. We don't think it's going to be much different from the guidance that we got for our life-sustaining businesses, but we need to know about certain businesses and will they be able to open or not, that we still have some questions about.
Do you think that you will get that at some point today? And do you think that at some point here we'll get a list that is a little bit more clear in terms of delineating what can and cannot reopen?
That's what we're hoping for, and we sent a list of about 15 questions on specific businesses that we here in Erie County had some questions on to the Department of Community and Economic Development. So obviously first we're hoping to get the guidance, the general guidance from the state, and we hope that that has some clarity, brings some clarity to the questions we have. And then again, we had some very, very specific questions that we sent down to DCED, and we hope to get that back as soon as possible, because for one thing, our businesses need to know. They need to know whether they're able to open come Friday or not. And then if they can open, what exactly do they need to have in place to be able to open their doors? And so the longer that we don't have this guidance and can't help them along with these decisions, the more difficult it's going to be for that business to get up and going.
Do you think you'll get that later today, or would that likely be tomorrow, perhaps?
As I said, we were told we're going to get it yet today. So we are just waiting. But I was told within the last 30 minutes that we will have this today. So we are waiting on that.
Thank you.
Jet TV.
Yeah, hi, Kathy. It's Samir. So I guess right now it's safe to say there's a fear, I guess, moving into this yellow phase, especially with the lack of residents wearing masks and continuing to socially gather.
There is a big concern. Our surveillance teams were out over the weekend. They were at campgrounds. They were at marinas. They were at golf courses. They were observing just to see, what the compliance was. A lot of the things that I read in the report was the lack of social distancing, and then, groups gathering, maybe not huge groups, but small groups of people gathering and not having masks on, and again, not being 6 feet apart. It's hard to tell when you're just watching that, are these people that live together? Or maybe they're just a group of good friends that don't live together, but then they should have masks on. So they were gathering that just so that we can then hopefully have some talking points going forward for these businesses as we speak with them individually.
And then obviously we want to start to reopen the economy, especially here in Erie County and across the Commonwealth. But is there kind of a fear that we might be jumping ahead a little too fast?
Well, I think if people follow the guidance that we have given and the guidance we're going to be continuing to refine and give them, I think we're going to be okay. I think we are going to see somewhat of a spike here, but we have to have our partners out there, and that has to be the citizens and the residents of Erie County. The other thing I know that's really concerning is the people that are coming here from other places. I know for a fact that there was people in Erie County this weekend from Allegheny County coming up, for example, to put their boats in the water. And Allegheny County is definitely under a stay-at-home order, but actually we're under a stay-at-home order still until Friday. So for them to leave Allegheny County and drive all the way up here really concerns me. And that's something you can't really control, but those are the kind of things that worry me as I think about this.
Perfect, thanks.
Erie Times News?
Yes, Kathy, it's David. Just to kind of further on that, you say there's really not much we can do. Is there any enforcement we can do? Specifically, let's say if someone from the Pittsburgh area is trying to put their boat in the water, I mean, do we have personnel that can say, hey, you're not supposed to be here, or to follow the right protocols? You know, is there a way we can do this?
Well, you know who can help us with this is the marina owners or the marina management. They could say, if you are not from Erie County or one of the counties with the yellow phase, you're not going to be allowed to put your boat in the water. But I don't know if they'll do that because those people pay money too. But that's where it could actually stop, is at that point. The same with campgrounds. You know, they could say, you know, where do you reside when people call to make a reservation or go online to make a reservation. But I don't know if a business will do that or not. But these are the things that we don't have, certainly manpower. We're not going to do a traffic stop and check and see where people are from. And you know, you're not going to even stop a car that has an Ohio license or a New York, really. And people come over here sometimes just because they have to shop. Let's just say they're from, you know, one of the more rural counties right around us, and they don't have a lot of stores. And so they come here to get their groceries or some of their other household items that they can't find near where they live. So we know that that kind of commerce happens all the time. But the more and more that we see people traveling longer distances, especially from these counties with higher cases, those are the things that worry me. And so really it's going to be about the citizens and how responsive our business owners are and the residents themselves, as well as the other people who may be coming to our community. And how do they act once they get here?
Does the county have the authority to require that the marina owners and the campground owners check residency, or is it just something you can encourage them to do?
We can encourage them to do that. I don't believe that we really have the authority to do that. And we don't obviously have a police force. Not that I would even want a police force out there doing this. Again, none of this should be punitive. This is about a virus. This is about a pandemic. And we need people to be helpful. It's interesting, I'm reading the book, The Great Influenza, which is about the pandemic of 1918 in the flu that happened then. And there's pictures in the book, and everybody's wearing masks. You see the military wearing masks, you see police wearing masks, you see all sorts of individuals out and about wearing masks in these pictures. And a mask truly does protect you when I wear one, and yours protects me. But I was disturbed this weekend even with some of the news stories I saw where police officers in pictures with people not wearing a mask, not 6 feet apart. This is a concern for me. We all have to be the example. And so that's why I kept my mask on the whole time I hiked out at the Bluffs yesterday. And I wanted to not only keep a mask on for your protection, those I came about, but I also wanted to be an example to people of how you can wear a mask appropriately when you're out and about. Talk Erie?
Yes, hi Kathy, it's Joel Natale. I was hoping that you could help us with the timeline of the patient that was put in jail on Friday night. Now, according to Maddie O'Neill's post on Go Erie, the patient first showed symptoms of COVID-19 on April 12th. That was Easter Sunday, but she did not sign an isolation order until April 29th. That was just last Wednesday. Do you know when she might have been tested, since it was 17 days of a gap there and her activities between Easter and last Wednesday?
I don't have those dates in front of me, and so I do not know those dates exactly, but we do know that she did sign her isolation order letter and agreed to that. We do know that there was multiple conversations with the nurses at the Erie County Department, I should say one nurse particularly, at the Department of Health explaining. There were complaints coming in about this individual being out, and eventually within a 48-hour period there was 4 different incidences that really brought that to a higher level, and then actually the individual did then say, yes, I was out, when I should have been isolated when I had signed the isolation letter. So those are the kind of things that happen, and it was really, truly unfortunate, and no one really wanted to ever have to go down that road. But in the end of the day, we have to protect the community at large. We have to protect the people, and if we know that something dangerous and potentially even life-threatening is happening, then you have to take action.
But since it's possible that she was already symptom-free, if it's a 14-day incubation period, it was a 17-day window between symptoms and signing the order. It's very possible by the time she signed the order, she would have been able to be released. Is that a possibility?
I'm not going to get into what's possibilities and what's not. I'm not the person making those calls. I'm not the nursing staff dealing with these patients. Those individuals, and they testified over the weekend in that hearing, and the judge obviously felt that there was enough there to take action. Jet TV? I'm sorry, Erie News Now?
Hi, a question for you again about businesses. If you get that guidance this evening, is there somewhere that business owners could be calling or looking online, anything for that, or would you likely release it at tomorrow's news briefing? And can you tell me more about the specific questions you sent to the state? What sort of businesses are still in that gray area as we try to sort this mess out and get ready for Friday?
So as soon as we get the guidance and are able to, we will put it up on our website, eriecountypa.gov, under our business resources section, which is really very easy to find on our webpage right now. And we'll try to make sure that we get that up, as quickly as we can. It depends on what time of day we get it, because I've got to have staff who can actually get it on that website. So if it comes too late in the day, it won't be up until tomorrow. But you can look for it there, and the state pretty much posts it also when they release it. So it's up fairly quickly for those who want to read that as soon as it comes up. And you had a second question, I'm sorry.
I did, yes. I'm just curious
Oh,
about what specific businesses are still in that gray area trying to get ready for Friday.
Yeah, we had, that came from my staff. I'm actually just going to, if I can just call up a quick email here, it might be easier for me to do that way, where I can look and see what some of the questions were. Anyway, there was a number of different things. I mean, I asked specifically about libraries, for example. That was one thing I wanted to know about. We had some questions on that. We had some questions, I think I mentioned the other day, about dog groomers, and we had some questions about some specific businesses. And I'm sorry, to answer your question, if you can give me a minute, I'll come back to that, because I've got to call up an email to see what those specific businesses were. Okay?
Absolutely. Thank you so much.
Sure. Jet TV?
Yeah, hi, Kathy, Samir again. So what kind of businesses, I guess, do you foresee opening or not opening? Do you have a guess?
Well, I think most retail will open. A lot of our small retail shops, a lot of our smaller vendors out there will open their stores. I don't believe them all will be open, but I don't have clear guidance on that yet. So we expect them to open up. We expect a lot of our other services to open up, whether it be notaries or whether it be even some people who, I'm not really sure. We really need the guidance here. I did get my list. Okay, so we asked about open playgrounds, church services, funerals, swimming pools, dog groomers, daycares, elective dental procedures, Airbnb, school events, garage yard sales, organized camping options. I mean, the list goes on. These are the kind of questions that we're asking the state. So we need to know this, because this is the stuff that people are asking about. Does 25 people include the employees? Is it okay for workers to return this week to stock and prepare stores? I mean, these are the kind of questions that we're asking. If the mall is not open, are the other stores in the mall area that aren't right inside the mall? And what does that mean for those stores? So those are the kind of questions that we don't have the answers to, and we need those also. Erie Times News.
Yes, Kathy. Maybe this is a good time, if you can, to point out, what is required of people, especially come Friday, if they're outside in a public area. Let's say that they're at Presque Isle. What do they need to do in terms of wearing their mask and how they wear their mask?
Sure.
And in terms of being within people, 6 feet. If you're more than 6 feet away from someone, do you need to wear a mask? Maybe if you can just run that down and,
Sure.
and let us, get people a thing for that.
That's great. So always have your mask with you. This is the mask I wore in here. I took it off before we started today. And if you're out and about and you are walking by yourself, you can just have this tied around your neck or however you wear your mask. Every mask is a little different. And then when you come upon people as they're coming towards you and you're getting closer to that 6-foot thing, just put your mask up, make sure it covers your nose and your mouth. I've seen a lot of masks being worn like this, down just over the mouth, and that doesn't do it. You got to have it over your nose and your mouth. And then when you pass that person again, you can just slip it down around your neck if you want. So that's the first thing. Anytime you're in a store, any indoor building like that, you've got to have the mask on the whole time. That actually is required, and that's required under the worker safety order. So the employees need to have a mask on, as do all the people that are in the store. So a mask is required in a store. So that's, I guess, the best thing I can tell you. If you're riding your bike, most likely you're not going to be within 6 foot of anyone. But it's good to have a bandana or something, a gaiter, something you can quickly pull up over your face if you get to that point where you are fairly close to somebody within 6 feet, and I'd say even a little farther than 6 feet. Because when you're working out, so let's just say you're riding your bike and you're exerted or you're running, your droplets from your mouth and your nose will go farther than just when you're normal breathing. So that's the other thing about working out, and one of the reasons why gyms aren't allowed to be open and such is because of what comes out of our nose and our mouth when we're working out. It's just more air being breathed in and out, and it goes farther, the droplets that I've been talking about. Does that answer your question, David?
So, for instance, one of the cases, if I can follow up for a second, I saw lots of people this weekend sitting in a group, kind of about 6 feet apart, not wearing their masks or having their masks down, off of their face because they felt they were 6 feet or more apart. That's a problem, or that's okay?
They should have a mask on. So it's 6 feet apart and wear a mask. It's not either or. So we say, wear your mask, stay 6 feet apart. And so when you're with your friends, I've seen people having like a driveway gathering maybe where they're setting chairs out. Wear a mask. It's going to protect you, and it's going to protect your friends who I know you want to protect. And as we move into this yellow phase and we believe that the COVID-19 starts to move around more in our community, it's going to become even more imperative that you wear your mask and keep the 6 foot distance. They're both needed, and it's not either or. And it's also partly around the amount of time you're with somebody. So, when you're just walking down the street and somebody's coming up and they're close to 6 feet and you just whip your mask on for a few seconds while you pass each other and then you can put it back down, that's a very low chance that something's going to pass between you and that person during that very short exchange. But when you're sitting there with your friends, maybe for an hour, chatting and enjoying each other's company, then you have a greater chance because now you're with them for a little bit longer time period. And the other thing to make sure is that you aren't sharing food in, for example, let's just say you have a bag of chips. You don't want to pass that bag around and have everybody pulling their hand in there and bring the chips out. Because remember, the virus goes from usually your hands or something you've touched to your face when you touch your nose or your mouth, something in your face here, and that's how the virus tends to move in. That's why the washing of the hands is so important and why the sanitizing liquid is so important. So these are really basic hygiene things that all of us can do. It's just a new behavior that we've got to all figure out and find a way to do it. Talk Erie.
Yes, ma'am. The state is now reporting 5 cases in Erie County coming from long-term care facilities. That's 3 residents and 2 workers. Can you explain anything that's going on? It's an actual 4 different locations in Erie County now. Is that going to be a source of alarm?
It's not in our community as of yet, and a number of those cases actually are the people have fully recovered. One is deceased. So we think that we don't have any major issues that concern us, but we do know, looking at other counties, that it is a huge concern if COVID-19 would get into any kind of a congregate living setting. And that could be a nursing home, it could be one of our treatment homes that we have for example, drug addiction, or people with different types of disabilities. So we have a lot of those really great facilities here, probably more than most counties, even per capita. A lot of people come to Erie County for those great services we have here. And those are always a huge concern. So there's a lot of guidance for those type of facilities. And so far, you know, we've seen just really great compliance from them, which has really kept the COVID-19 from mitigating to those areas and become a problem. Erie News Now, do you have any final questions? Erie News Now, are you with us still? How about Jet TV?
Yep, just one last one, Kathy. So as we move into the yellow phase, let's say at box stores like Walmart, et cetera, Target, people aren't wearing face masks. Could there possibly be any violations for that entity if they're not enforcing that?
Well, there could be for the business. It's really up to the business to control that. They need to have signs outside saying, you know, like no mask, no service, or whatever kind of signage they want to have. And they need to be enforcing that when people come into the store, that they all be wearing a mask. It is up to the business.
All right, thanks.
Erie
Kathy, can I get back in, please? I'm sorry, my call dropped out on
All
me
right,
there.
sure, yes. I was wondering what happened there.
I'm sorry about that. I wasn't trying to abandon you there.
No problem.
One final question for you about the 25 people limit. Is there anything there about, do you think, square footage as well? I know we're looking at the employees count, but, you know, say you've got a store the size of a big box store, but that's not essential, something really large as opposed to a smaller boutique. Do you think we'll see some sort of guidance there as well that, you know, a large area, even, say, a church that could accommodate more people if you had them spread out? Will that play a role here?
Well, that's a big question that we have, and that's why we're asking that. I did ask that question last week when I had some of my conversations with the state, and I was basically told no, they would not be doing it by square footage, which to me seemed like it would make more sense in some ways, like they did with construction. If you look at the construction guidelines, they had a certain number, and then as a construction site grew, you could have more people working at that construction site. It seemed to me that we have some very large stores that could certainly accommodate more than 25 people. And does it include their employees or doesn't it? Because obviously some stores would have 25 people right away, and then there would be no one allowed to come in. So questions. We have lots of questions for the state, and that 25-person and guidelines around that is something we really want to hone in on and find out the answers to.
Thank you so much.
Sure. Erie Times News, do you have any final questions?
Yeah, Kathy, a quick one, and then if I can follow up on something. When you were talking about the nursing home cases, you said one of those persons was deceased. That is one of the 2 deaths that we have already reported for the county?
Yes.
Okay. And then a follow-up.
They didn't die in the nursing home, I don't believe, though. But they had been,
Okay. But
anytime they were in one of those places, they get counted towards us, so, yeah.
Okay, gotcha on that. And then I want to follow up specifically about the Mill Creek Mall. You had said you were doubtful that that's going to be able to reopen on Friday. What leads to you being pessimistic on that? Why do you think the Mill Creek Mall is not going to be allowed to reopen?
Because when I directly asked the question, I was told that they would not be. So unless they've changed
Did they
their guidance on
why?
that,
Does it have
I
to do
was,
with travel?
I'm sorry?
Was it specifically about the concerns about travel from out-of-town customers?
No, the concern that I was told was because of the numbers of people and how would you control that. So it went back to that 25-person number. And of course, we know that the mall would have way over 25 people in it total. So that's what I was told. But we're waiting for guidance. Talk Erie, do you have any final questions?
Yes, just a quick follow-up. What other circumstances would you anticipate that would require an arrest and imprisonment of someone violating some of the standards of the emergency declaration?
I'm hoping that there's no other circumstances. This was a very difficult thing for the whole team, and we never wanted to have to go down that route. But there was an individual who we felt was truly endangering the community at large, and we needed to stop that and really protect the community. So it's really would be mostly around a person who we know is positive and we know is violating that isolation order. You know, the isolation is only for a specific amount of time. It's something that is really crucial that we all stick with if you do come down with a positive result on a COVID-19 test. And even the quarantines, you know, this quarantining and isolation piece that we've been doing for over 7 weeks here in Erie County truly has been the tool that has kept our community with as low a numbers as we have. Again, if you look at the rest of the state, even look across the border into Ohio at Ashtabula, a much smaller county than ours. What did I say, 15 deaths, 146 cases, something like that. We have done what we needed to do to protect the community here. And in some ways, people think, well, it's not so bad here, so it's not a big issue. But when you think about even the numbers in our whole country and where they're at, those numbers are still very large, and that's with a country that was basically shut down. And Erie County's numbers are 93 in a county that was basically been shut down. So once we start to open up, you know, these things could all change. So you know, we've got to all work together here. It's going to be really up to us. It's going to be up to the people of Erie County and the people that come to Erie County. And what do we do to protect ourselves and protect our families? And as I said on Saturday, and I'll say it again, if you don't feel comfortable going someplace, if you feel like the people around you are not doing enough to protect you, then take yourself out of that situation and go back home until you can go back to that store or wherever where you feel okay about it. Because you are going to be responsible for your own protection as well as the protections of those that you love. And so if we all look at it in that regard, hopefully we'll all make the right decisions as we go forward. And with that, I will tell everyone that I have now moving to a Monday through Friday schedule here with my press events. I'm going to no longer have the Saturday, and that will start this coming Saturday, but I will be with you for the rest of the week, Tuesday through Friday at 3 p.m. And I really thank you all for joining me each day as we talk about COVID-19 and really taking the message to heart. But even beyond that, please continue to take this message out to those who don't tune in, because we need everyone to understand the importance of the guidelines and why we all need to do that. And so in the meantime, please continue to stay home and stay safe. And finally, please stay calm. Thank you.